I am Dr. Swannie Jett, and I have a passion for public health for over 30 years. Now, I'm in a position to affect change. And these are the critical conversations about health in our community with the people who can help me make those changes. Welcome to CEO Live Talks. I'm your host, Dr. Swannie Jett. I have my good friend with me today, Miss Ashley Sokoler from American Heart Association. Welcome to the set.
Thank you for having me, Dr. Jett. I'm happy to be here.
Thank you. Thank you for coming on this cold day.
It's been worse. I can handle this.
Right.
But it is cold.
I can't handle this. I need it to be 50 and above.
I know.
Right?
Yes.
Well, you don't have to put on long johns.
I know. I'd prefer that as well.
So where did you grow up at? I'm curious.
Yeah, we haven't really talked about this.
No.
Getting to know each other, I'm here for that.
Right.
I consider myself a Louisvillian. I have been here since I was about 11 years old.
Okay.
And I am in my 40s.
Okay.
So we can do the math there. I never left. I was brought here by my family. My father was in broadcasting. Mm-hmm. And so that brought us here back in the day, like Louisville Tonight Live back in those days. So
I remember that.
familiar with, the behind the scenes of media and being on air. And so I just never left.
So, you being on air now, this should be easy for you since your daddy won 2 Emmys.
You would think
reporting.
it was easy, but it never gets easier.
Okay.
So for me, I'm not one that necessarily loves to be in the spotlight. I do deep down, but at the same time, internal demons. I just want to make sure I'm polished and positioned in the right way. But
Because you had to watch your father growing up.
I did.
Okay.
My entire life. So he started, my dad, Bob Sokoler, started before I was born. So I was born in Baltimore, Maryland, and he was actually on with Oprah. Mm-hmm. And my claim to fame is that she held me. Oprah held me when I was a baby. That's my fun fact.
You get a baby.
Right. And so we were there for a couple years. We moved to Florida for his career. Then we were in Atlanta for a short stint. Mm-hmm. Came to Louisville and never left. Okay. Never left. But yes, always watching him from behind the scenes.
And so then he transitioned to real estate. And that's right. And then you was in real estate.
Oh, you have done your homework, Dr. Jett. I knew you would. Yes. So I did. So after I graduated, and I'm a public school kid, went to Cameron Middle School, went to Ballard High School, and then I went to the University of Louisville, go-karts. And I danced and was on all the dance teams and danced for the Ladybirds for 2 seasons. And then I did. I graduated and wasn't really sure what I wanted to do. I did a little bit of event planning and consulting, and I thought to myself, I'd rather be in front of this, not behind the scenes so much. But it was a great learning lesson. And from there, my dad said, come, he had gone through. So he was in broadcasting, on air. Then he was on the radio for a couple years with HAS. And then he got out of that and said, come do this with me. This would be a really great, interesting. And I decided at that point, right around 2006, things were not so great with the economy.
Right, of course.
And at that point, I decided to get out of that, and also decided the family business was not for me. So
it's kind of difficult working for a father. So I'm sure he probably was demanding.
Yeah, expectations,
and
like any boss. But yeah.
So tell me about your mother.
So my mom was a saint. She was amazing. She passed away just about 8 years ago from breast cancer.
Yeah, sorry to hear about that.
Thank you. She lives on. We talk about her often, and she was all things to all of us, myself, my younger sister, and my youngest brother. And so she was... She worked for Delta back in the day, the days when you had to, if you flew standby, we had to dress up. You had to walk the walk. And, I still carry that with me a little bit. Now,
they smoked cigarettes on the plane back then.
Maybe, probably, but I don't remember. Yes, I'm sure so. Back in the early 80s, yes. And then, yeah, I mean, she was obviously supportive of my dad's career and profession, and she stayed with Delta as she could as we moved. And then fast forward to probably around 20 years ago, she jumped in with my father into the real estate game. And so that was what she did until, she had a couple stints in remission and just went into metastatic breast cancer. It was inflammatory to start. And so we did all the things, and ultimately, she passed away a month after my son was born. And so I was on maternity leave and felt really blessed to be able to have concerted time with her, at the end there. So
yeah, that's always good.
Yeah.
So tell me about your brother and sister.
Oh, well, I'll keep it PC. But yes, my brother and sister. So
it's always tough. Were you the middle child or the oldest?
I'm the oldest.
Okay.
I bet you probably could.
So you dropped the hammer.
That's right.
I could tell.
Yeah. Could you? I set all the expectations, and if you ask them, they would probably say like, I'm the favorite. And whether they agree with that, I do feel like I'm the favorite. So I will be 42 this March. My little sister is turning 40.
Okay.
And then my brother is 6 years younger than me. So he is in the real estate game with my dad and does all of that. My sister is in the health field. So she's an ultrasound and radiology tech with one of our health systems here.
All right.
So like she's who I go to because I'm a hypochondriac. And so if I'm like, Lauren, this, and this. And she'll be like, you need to calm down. Go see a doctor, or do this, or do that. Don't Google. So,
She told
really
you smart advice. Don't Google, because a lot of people want to Google medicine now.
Yes.
And it's very difficult.
It is. Would you Google if you had some sort of ailment that you were curious about?
I'm an epidemiologist by training,
Okay,
so,
fair. So you know.
so I know a lot of different things, being in the medical field. But, during COVID, it was interesting, even though I know the science behind it.
Right.
Everybody else was trying to tell me the science behind infectious disease. So it was always a little bit of conflict.
Yeah.
So I'm sure your sister gets that.
She does. Yes. Yeah. So we're very close.
Okay.
We all live here in Louisville within probably 10 miles of each other.
Okay.
So we see each other, and then we all have kids, and they're close.
So how was it growing up having two parents and your siblings? Somebody had to play good cop, bad cop, so I'm assuming your dad was the bad cop or the tough one, one of your mom was the nurturing one.
Yes. Right. And that is still like, it's interesting because even to this day I find myself, like the balance of good cop, bad cop with my own kids. But yes, we all try to stay on the straight and narrow.
Somebody has to do it though in the household. Somebody has to take on the role of disciplinarian.
Yeah.
And then somebody come behind and be like, it's okay.
Yeah, then that was definitely like, my dad was very busy just in terms of his career and profession, but you did not want to mess with him.
Right.
He was the disciplinarian, and then my mom did. She would come in and be like, try to ease it up.
Ease it up a little bit.
Yes.
Okay.
Yeah.
So after graduating from high school, from Ballard, what made you choose University of Louisville?
Well, I had been in all the feeder programs, Planet Dance, and like all of the dance structure where it was like, okay, if you're going to continue on, like being a ladybird was kind of like the top tier.
Okay.
And so I just continued on that path and leaned into it and did my best to be able to get on the team, and I did. And I did that for 2 seasons and then decided that I did not want to do that anymore. And so moved on. And
so you fell out of love with it?
So I will say I didn't fall with that.
Didn't fall out of love, just the hard work, the routine.
It was a lot. There's a lot of politics. I still to this day adore and love. I've just separated myself. Obviously, I support the Ladybirds and cheer them on from afar. But yeah, I wanted to focus on getting my my kind of academic piece just done in terms of graduating in 4 years and ensuring that I had the focus on the academics, and just parted ways with that program at the time. I still continued to dance. We used to have, sometimes I don't admit this, but we had a couple programs that were semi-professional here. So the Louisville Fire Arena football team was a group
I remember them.
that I was involved with for many years. And then for a couple seasons, we had the Kentucky Colonels basketball team. And I was a part of that program as well. So didn't necessarily lose the love for it, and in the meantime, I was also coaching. So I went back to Ballard and I coached their dance team for many years, as well as Cameron Middle School's dance team. So that was kind of cool to be full circle.
Yeah, that's full circle.
Yeah. So I loved that. Did a little bit of, cheer coaching for elementary schools, and that has stayed with me. So I still, have a passion. I still on the side do teach classes and to young kiddos, but also adults who want to maybe just kind of dip their toe in the water and have more fun.
Hello, my name is Sierra Clark, and I'm the Chronic Disease Manager at Park Duval Community Health Center. Ever since I started at Park Duval over 9 years ago, I have been committed to helping patients live healthier lifestyles. I am currently serving patients in the Chronic Care Management Program, or CCM program. My team and I help patients manage their chronic conditions such as obesity, high blood pressure, high cholesterol, and diabetes. In this CCM program, you will receive several benefits to help you manage your health. We offer monthly telephone calls to check in with your progress and to assist you with any concerns, assistance with scheduling your healthcare appointments, and assistance with filling your prescriptions in a timely and convenient manner. We also offer many resources to help you with the barriers you may face with eating healthy, being physically active, or monitoring your conditions at home. For more information, visit us online at pdchc.org or visit one of our health centers.
Hello, I'm Dr. Swannie Jett. Please make sure you visit one of our 5 locations, not only in Louisville, but outside of Louisville and surrounding areas. Thank you. I'm always curious on how people balance, going to school and athletics.
Yeah.
So, I know it's very difficult for me being a former athlete.
Yeah.
So how did you manage as you was going through it? Because a lot of people need to hear that.
Yeah.
How do you manage? Because that's project management, that's time management.
It is. And I look back now, I'm like married and I have 2 kids and like priorities and juggling things. I'm like, how did I do that back in the day? But in hindsight, I think prioritizing, because you're really, as an athlete, I believe, that's going to be your primary.
That's your primary.
You've got to look at that first, right? And so you basically have to adjust to that and say, okay, if my practices, if these things are happening, you got to work around that for your academics, as I remember it.
Right.
And so that's got to be number 2 priority is okay, because you got to keep the grades. Right. You gotta make sure you're handling that. And my caseload, my academic load was probably at the minimum to be full-time, just transparently. It was, doing that. And I graduated with a bachelor's degree in arts and communication. And so I focused on those specific classes. I considered staying on. I did sign language actually for a couple years.
Okay.
I do regret that. I wish I would have stayed on because at the time they only offered certain classes, certain semesters. Right. So that would have extended me out. And I was like, no, I'm ready to move on. Right. Yeah. So I think for prioritization and just looking back at that, it was the athletic component of it, working around that, getting that schedule to where you could get your classes that you needed to. And then I worked also outside of that. I was a roadie for Texas Roadhouse. I think I did everything yet but managed there while I worked at Texas Roadhouse. But that was how I balanced it. So I was able to, my parents were like, if you want to live off out of the house, you're going to pay for your own. So that's how I did it. Those were my 3 focuses. And I probably threw a little bit of fun in there when I could.
Oh, I'm sure you did.
However, that's how it worked. I mean, I knew what I had to get done in order to be
And it's kind of tough to work and then be an athlete anyway.
Yeah.
And then go to school.
Yeah.
So, because most of the times I just worked in the summertime.
Yeah.
Unless you had some type of work study set up.
Right.
So that was too difficult.
Yeah, it's a lot. It's a lot.
Right. It's a lot.
And I still look back and I'm like, how did that happen?
Why did I do it, first of all?
Yes, why? And I mean, maybe it's just me, but being young and in your early 20s.
You think you do anything.
You do a lot.
Right.
Yeah. So.
You do a lot now, so. Arts and communication, what path were you thinking at that time? Because it's interesting, because you've danced now, so I'm curious.
I know. At that time, I really thought perhaps I would leave Louisville. And it was always a dream of mine to at least audition and go into the pro field of dancing or cheering for an NFL or NBA team. And I didn't do it.
Okay.
I didn't do it. I just, don't know. And things have changed so much. I mean, the competitiveness and the skill. I mean, I talked to a lot of my peers who danced and were like, we couldn't do half of what these athletes do now, right?
Well, times have changed because the athletes are bigger, faster.
Yes.
I've seen so much since when I played. It's
Yeah.
like,
Yeah.
okay.
Whatever sport, whatever you're talking about. Yeah, it's so much like that. And but yeah, I didn't really honestly know what I wanted to do. And I wasn't tied to the community for really anything specific. I had the opportunity.
Okay.
I didn't take it. And I went straight into the work field of event planning and coordinating. And I didn't know if that's what I wanted to do, but I told myself, like, you'll figure out if this is something you don't want to do.
Right.
And then the path just led me forward to real estate. And I ended up finding the man that I married initially and have 2 children with. And we are no longer together, but have a really great relationship in terms of co-parenting. And so, at that point, then you're here, you're tied here. I don't want to go anywhere. So, getting out of real estate, I did love, I started to figure out, like, I do love relationships with people. Like, I do love
talking
that.
to people.
I do. Yeah. I didn't really understand the full scope, still being young. But at that point I had, met the person I was going to marry, and I was like, I really need to find something sustainable. Real estate is cutthroat. Can be.
Right.
And so I fell into nonprofit. I was looking for something, and I found the Muscular Dystrophy Association, which is a national nonprofit. At the time, they had an office here, and I went with it. I went in and interviewed. I liked what I saw. It was relationship building. It was connecting the dots. It was, identifying new business and diverse business, and learning about things in our local community, but abroad that affect people in a negative way. And then I can also help. Right. And so that lasted 3 years being there. There was a little bit of a ceiling there in terms of growth.
Right. And you found a new pattern.
I did. And that is exactly what happened. I started looking for other opportunities, and that is where I found the American Heart Association. So I have now been there for 13 years.
Long time.
It is.
Right.
It is.
So I probably know some people who used to work there.
Probably.
Well,
Probably.
So you have a lot going on, a lot of different programs.
Yes.
But we're in red for a reason.
We are.
Right? So tell me about the different programs you have going on.
Yeah, no, I'm happy to. So you mentioned the red. Well, the Heart Association, obviously, we wear red all the time. Also, as an alumni of U of L, it makes it very easy for me to wear.
Makes it very easy.
Very, very easy. And, depending on when this airs, also a Chiefs fan.
Right.
So there's a lot of reasons to wear red.
Yeah, it is. I'm still heartbroken.
I'm sorry. I mean, I couldn't not bring it up. And again, we'll see how.
I was going for the Ravens, but I kind of had a feeling the Chiefs.
I know. It made me sad. I mean, I'm a Lamar fan too, so it would have been a win-win.
Yeah.
So wearing red is easy for me. I have a lot of it in my closet. But yeah, we're doing a lot. And so, February, number one, first and foremost, is National Heart Month.
Correct.
And so we're encouraging folks to wear red from an awareness perspective. Like, number one, first and foremost, for what we do at the Heart Association, education awareness is number one. And one of our guiding values is health and equity for all, period. And that can be very overwhelming, because that can mean a lot. It can be a lot of work, and it can mean a lot of things to different folks. Right. And so there are so many programs, but as it pertains to February and our focuses that will never go away from the Heart Association's lens, like, we're interested and always wanting to make a positive impact in health. And what does that look like? That might look like education around knowing your numbers, and where you stand for yourself, being an advocate for your loved ones, for your friends, for your coworkers, and that can also mean a lot of different things. So, the Heart Association is a national organization. And sometimes that can be looked at as a negative when you're working with companies or individuals because of the amount of support we get, and that is true.
Right.
However, one of my objectives as the executive director and a goal that we have locally is to be seen as a local entity that is making an impact in our local community. And we have the bandwidth and the ability to do that.
Right.
We can do that, and there's so many different ways. And it can be blood pressure screenings. It can be providing refrigeration and needs to food pantries or community health centers. I mean, there are so many things that we can do.
Hello, everyone. I'm your host, Dan, and welcome to the Real Vaccines of Park Duval, Season 3. Today, I have two vaccines that have some unfinished business. Everyone, welcome to the stage, the wonderful flu and COVID vaccine. So, flu vaccine. Let's start with you. What exactly is the issue?
I just think the flu vaccine should be available to all PDCHC staff and patients. I mean, it's flu season, so COVID is not really important no more.
See, this is why we have an issue. People need my updated monovalent vaccine to protect themselves from the newest strain of COVID that came out earlier this year.
Wait, both of y'all do know that Port Duval actually offers both vaccines, right?
Are you sure we offer both vaccines? Because according to the pharmacy, only the flu vaccine is available right now. And do you need insurance?
Yes, flu vaccine. That is correct. Park Duval offers the vaccine daily from 9 a.m. to 5 p.m. at all our pharmacy locations. And on other days, you can get the flu vaccine from 9 a.m. to 12 p.m. at your nearest PDCHC site.
Do you need an appointment for this?
No, you do not need an appointment either. The dates and locations are on the website. Go to pdchc.org to find out more information.
Yes, I'm glad everyone is on the same page now. If anyone has any further questions, you can reach pharmacy at 502-772-5029. Be sure to tune in for season number 4.
Hello, I'm Dr. Swannie Jett. Please make sure you visit one of our 5 locations, not only in Louisville, but outside of Louisville and surrounding areas. Thank you. So, I know you do a lot.
Yeah.
You've been in position for 13 years.
Yeah.
What is your next 2 to 3 year plan and your goal for the operation?
It's a great
Like,
question.
do you have one thing that you want to achieve?
Ooh. Well, I will clarify and say, so I've been with Heart for 13 years and I've moved my way through the organization. So I've been in the executive director role for 5 of those. But what I think that affords me, just like, anybody who moves through the, different lens and, pre-COVID, post-COVID, like you're pivoting, you're changing. Things have definitely changed. I know not industry specific, but for nonprofit, when we're talking about how you operate, right? Because it is very different from a corporate landscape and lens. You've got people who are working remotely. You've got people who are allocating funds differently. It is for us in the field of development, we are continuing to ebb and flow and figure out the right way to engage with our volunteers, our constituents, the companies, the individuals the grant funders, the foundations. And so I feel like for me, all of that information and the way we've done things in the past is not the way we're doing things currently, and being prepared to ebb and flow again, like future facing. And so for me, when you ask the question, like from an organizational standpoint, what do I see in terms of the next 2 to 3 years? Internally, I will say I'm building the bench for continued success and leadership within my team, because, for me, I look ahead and there's a lot. I'm not going anywhere. So any of my team or anyone that sees this, like I have no, intentions to leave the organization nor move out of my role. But I have to look at this and say, what's the future hold? And I think any good leader does that to say.
You got to have a succession plan.
You do.
You got to make sure you're doing professional development to make sure you have a bench of people that can fill in different roles.
Right.
And then maybe you can focus on something else. at the organization.
Exactly.
Yeah.
So first and foremost for me, Dr. Jett, it's really looking at, and we're there because I have had some turnover and in nonprofit, quite frankly.
That's what happens.
It's, yeah, and I mean, if you're not vested for, you get to this 3-year point, that's what we say, then there's a good chance you're going to stay.
Right.
And you've got to create the culture and the climate, and I have a lot of new team members, and I'm excited about that.
Right.
But I think from an internal focus, that's really where I've got to spend some of my time from a managerial lens, and I've got it. I see it there. But we're gonna really work hard to ensure we're all representing the mission and our ability to be out in the community and make an impact. Like that's got to be tight and it's got to be right. Like we've got to make sure we're out there representing ourselves in the best way possible, so that when we're talking to potential donors, that they see it and that they feel the passion and the way that they can really help the community. So that is one part of it. And then in terms of the next 2 to 3 years externally, we've got, there are things that I'd love to see happen in the community. And it does take the funding, and that's going to be trying to continue to expand our landscape, diversifying with our board leadership, bringing in new folks, just generally, whether it's corporate and or individuals. I would love to see a CPR training kiosk, a hands-only kiosk in our community. We do not have one.
No.
And to me, that is a great opportunity to train masses of folks. And this kiosk that we have, it's interactive. You are literally pressing on a chest and you are learning what to do. It is transportable, right? So we have the ability, whether it starts in the airport and moves to other places that has high foot traffic within, call it Louisville proper, surrounding counties, like we have the ability to do that. And so I think about, we would have the data and the metrics to support that by those that are, so for me, that's always been a dream.
How much did that cost?
So it is a little bit of an investment. And so it's somewhere to the tune of couple $100,000, but that is over the course of 3 years. So it creates a sustainability. We work with the potential donor, one-on-one to talk about the upfront costs, and that's primarily it. And then we have, like, on that 3 years, we spread out the cost of that, so it can be planned for from a budget allocation perspective. So that is one thing that I think is we're, would love to have from our strategic focus on CPR education and training. And then there's the mental health component, which we know kind of comes back to that holistic approach and getting some touch points within our corporations that, again, and that's not necessarily costly. That's us engaging with HR. That's us engaging with that. And then there's the nutrition component and helping to support our local food pantries and communities. So there's a lot of things, but I'll stop there.
There's a lot of things.
Yes.
So I have one last question for you.
Okay.
And this is an important question.
Okay.
So to make your programs work or your initiatives, how much money do you need?
That's a good question. So,
Right? Because we're the nonprofit world, so we always fundraise.
Yeah, we're always fundraising. I don't care what seat you sit in. Yes. And so we have annual budgets, right? So this year we're working to raise $2.2 million in our local community, and we are about halfway there right now.
That's good.
It's good.
That's good.
We are what I would consider on track. And our third quarter, which is what we're in from a fiscal year perspective, is big for us. We have a lot of things going on in really February, which is Heart Month. A lot of companies and individuals rally behind us to support us in that way from a monetary perspective. We also have our annual Heart Ball that is on February 24th. And so it is our 100 years. You may or may not have noticed
I noticed it.
My swag here, my lapel. And so it's our 100-year anniversary from a Heart Association perspective. So we are looking back at where we were in 1924 and where we are going in the future. And so we're really excited about that. And, we are going to celebrate in the room at our gala the work that we have done so far, and then talk about the future facing of what we can do here in the community. And so that event in itself is an immense amount of support that will bring our goal to get to our budgetary goal pretty far in advance. And we're also working with other individuals, grants, and foundations that hopefully will come through in this fiscal year that will get us where we need to go. So we're always having stretch goals. I can't tell you where we'll be next year. I'm sure it'll be upwards of raising, 2.5, 2.6 mil. But first, we're focusing on the now. And yeah, so to answer your question.
I love that.
Yeah.
I love that. I will be there.
Yes,
I look
so
forward to
excited.
participating.
Yes.
So, it was great having you on the show.
Thank you so much for having me.
Thank you so much. Thank you for joining us today. Look forward to seeing you next weekend. And to donate to American Heart Association, please look them up at your local level. Thank you.